Okay, so I was training for the Chicago Marathon, as we discussed, and I was running quite a lot, obviously. I was running probably at 30, 40, at some point 50 miles a week, and it was all going very well. And then one day I went for a relatively short run. I had a sort of gradual pain in the small of my back. And then the next day I tried to do a tempo run, got about a mile in, and then my hip and my back really, I think, flared up is the right way to put it. And I could really hardly walk back up. I thought it was one of those things, thought it'd be better the next day. Unfortunately woke up and it was far from better. It was quite stiff, very sore actually. And with the marathon, I think it was 3.5 weeks away at that point. It was a bit of a problem. So yeah, so I looked you up to try and save the day. It was pretty compromised. So I work just down in Midtown on 34th and Madison, and walking here from there was quite a push. It took me a while. I normally walk quite quickly, and I was walking very slowly. I'd say I was taking a reasonable amount of pain relief as well to try and help it. But it was a struggle really to walk anywhere, even to the point actually where I was sort of just standing up and realised I didn't want to move anywhere to do things because it hurt quite a lot to move. So I'd reach and try and stretch to get something rather than just walk over. So yeah, so I certainly couldn't run. I could hardly walk. It was quite debilitating. Yeah. I was at first, the first few days afterwards, and if I didn't take pain relief, then I woke up. Particularly, it was actually, I woke up a few times, but it was more getting out of bed in the morning. It was the effort of standing up and realising I had to sit up and then stand and then hobble over. What I also found was I just ended up standing in quite a poor way. I stood up, so I put all my weight on my left leg. It was the right hip and right back, so as to keep it really relieved. So I couldn't weight bear particularly on that leg, which was very, very irritating. In retrospect, it definitely felt better. Even the first time. And then we had those 3 sessions quite close together, and it definitely felt bit better, and then I think I was probably over optimistic, and then a few hours later it was sore again. Again with pain, it's always quite hard to sort of say if it was particularly less sore. Certainly after the 3, it was much less sore. I mean, it made a big improvement. I had physical therapy at the same time, but speaking to the physical therapist, the difference she saw was pretty significant. Actually, she was very impressed by what a difference in the movement it made as well, because I was very stiff as a result of the pain. I only actually took about 4 or 5 days off exercise entirely, and managed to put myself on a bike, which didn't hurt. So I was biking, and then gradually after those treatments, I got myself on a cross trainer, which was slightly sore at first, and I backed off, went back forwards, managed to do the cross trainer. Then I ran 1 mile, I think, a week before the marathon. Then my next run, it was a bit sore. My next run was actually the day before the marathon, which is 3 miles, which is a little sore, but not intolerable by any extreme. And then the marathon itself, which thankfully went very, very well. Not much to my surprise, because I was feeling better, but considering the amount of pain I was in, it's quite surprising actually. It was, I'm very, very happy about it.
What was your time?
I did 3:19, so I was it's my first one, so I was pretty chuffed, yeah.
So the marathon was how many weeks ago now?
It was probably about 6-7 weeks, maybe 8 weeks at this point.
So how's this been area doing? So you did the marathon.
I did the marathon.
Was this really achy afterwards? Not so much?
No, hard to say, because after a marathon everything hurts. So actually my quads were extremely sore, but my hip, it was a little sore. It was nothing like it was before. But yeah, so after kind of the natural wear and tear of a marathon wore off, it's slightly difficult to answer, because you become so hyper aware of these things that whether it was really there or whether it was actually sore is hard to say. It was a bit sore, and now it's actually entirely fine. I've been doing other kind of rehab work, and I'm back to running again, and actually running's entirely fine now. There's no problems there at all. So it's, knock on wood, it's much better. But important lessons learned about standing up and stretching and movement and that rehab work. But yeah, I was, in retrospect, the running, the training went very well, but I was probably not supporting it with the other things I should have been supporting it with. So lesson learned.
Now you're an expert.
Now, yeah, now I'm an expert. Yeah.
Perfect.
Excellent.